Chief Minister Conrad K. Sangma and Health Minister Dr. M. Amprin Lingdo inaugurated the Apollo Trinity Medical Center at Lower Nongrim Hills, Shillong. Partnering with Apollo, the center promises expert consultations, diagnostic, and quality healthcare services. The Chief Minister emphasized that this collaboration with a trusted institution like Apollo will ensure accessible and high-standard medical care for the people of Meghalaya.
I'm so happy to be here today, and I really would like to thank and congratulate Mr. Deva Pirade, Mrs. Mehtab Chandi Sangma, and the entire team of Apollo that has made this particular project a reality. The structure of governance, it's not just health, but health has seen that move much further. And I'm sure our officials who are present out here will tell you how the health sector is reforming and how the involvement of the officials, involvement of the doctors has been at a different level, which has allowed us to really improve things and see where we are today. And of course, there's a lot more to be done. It's not that we are saying that we have resolved every issue. There's a lot of issue to be resolved, but clearly from where we were and where we are and where we are moving forward to, I can clearly see the direction and seeing that vision that our Chief Secretariat mentioned, that slowly and steadily Meghalaya, especially Shillong, of course, will gain that reputation of being able to provide good medical and healthcare services in the days to come. And that's really kind of a goal and a target for us, which drives us. Again, a very big target, but we feel that it can be achieved if we continue this momentum that we're doing. And while we do that, as I said, it's very important for us also to ensure that the health services at the rural area and grassroots also improves. So we are really focusing on that. You'll be happy to know today that 50% of our sub-centers have got solar-powered, solar panels that are powering them. So we have about close to 8 kilowatts to 15 kilowatt, depending on the requirement. And just our sub-centers alone produce close to about 2 megawatts of solar energy because of these centers. And this happened the last 3 to 4 years today.
Health Minister Dr. M. Amprin Lingdo highlighted the center's role in preventing financial distress for patients seeking tests outside the state. She encouraged medical practitioners to provide compassionate care, ensuring patients stays in Meghalaya instead of seeking treatment elsewhere.
Medical ailments, I'm told there's going to be a gynae expert, a medicine expert, a pediatric expert. In pediatrics, nephrology is a very, very, very huge gap in the state of Meghalaya because we do not have the wherewithal as of today. Hopefully with our medical college kick-starting, even that can be a collaboration that we can engage in. I'm aware, just very recently my uncle, so grateful to Apollo, so grateful how they gave life to my uncle, a dedicated priest, and today he is as fit as any other citizen. These are the kinds of things that we see happening. And Meghalaya, sir, with your vision, your strength and your determination, will be competing with the SAM very shortly, sir. Thank you so much for everything that you do. Your focused attention to the health department in the state of Meghalaya is testimony to your concern, because really the most expensive cost for citizens is healthcare. And of course, NCD is the mantra of this new generation. People just dropping dead, irrespective of ages, irrespective of their lifestyles or habits. So these centers of this nature will give people an opportunity to also attend Most of the people living in this community, I don't know about the women side, they're a little more affluent. But to the left of the center, they're all people who exist hand to mouth. And if you could have a therapy center here in this Trinity Apollo Center, because sometimes even accessing close proximity to recovery of major ailments related to cardiology, oncology, etc., is something that our people are in urgent need of. I thank you, sir, for allowing me to speak before you. I have broken all protocols. I apologize deeply to the organizers. This is election time. I am a politician. That is my first priority. And with these few words of encouragement to the staff, such a beautiful song. Compare, you are a little nervous, but it's fine. You're doing a good job. You're doing a good job. Dear friends, all medical practitioners, you are now working in this beautiful center. You are the first respondents to patients. And if you rise in the morning with a mad or angry mood and take it out on our patients, they're going to run back to Guwahati and the purpose of the center will be defeated. I urge my THS and her team to constantly be in touch with these experts.
Chief Secretary DPO Alang, the guest of honor, expressed hope that Shillong would regain its status as a healthcare hub with 2 medical colleges in the pipeline.
You see, I've already made my points very clear during my speech, which I had delivered about a few minutes back. I had gone into history right from the 1920s and the 1930s, when Shillong was known as the sanitarium and also a good place for people to come for medical treatment. I had narrated a few anecdotes also, and I'm sure that you would have appreciated what I had mentioned. Now, of course, in due course of time, because of competition from other states and also the health facilities being set up in neighboring states and all that, many of the patients don't come to Shillong anymore. What I was trying to say is that with the setting up of these new centers like this Trinity Medical Center and also other private initiatives that are taking place all around town, I'm sure that healthcare in Shillong will improve tremendously. I had mentioned about the functioning of the Shillong Medical College, which is going to happen from this year itself. The USTM also has set up a medical college in Khanapara. Then the medical college in Tura also will start functioning most probably from next year. So we are building up this health ecosystem in the state, which will ensure that people will get adequate health coverage and adequate health care within the state without any need to go outside the state to Assam or to Delhi or to Bangalore, Chennai and all these, Vellore and all these places. So we are hoping that this ecosystem will be developed and will take care of our citizens here in the state.